Hello, my name is Haitham Mekkawi, consultant of anesthesia and intensive care, and I promised Noon that I would make a cartoon just for her, but because I was busy preparing these lectures, I decided to do something better. I decided to host Noon in my lectures, not just as a visitor, but as our guest of honor, helping us ask simple questions so we can explain difficult ideas in a way that truly makes sense. And medicine. The word shock does not mean fear. It means failure, failure of circulation, failure of oxygen delivery, and if not corrected in time, failure of life itself.
So, shock is when the body starts losing its power.
Exactly, Noon. It is the moment when the body systems can no longer deliver what the cells need to survive. And today, we will explain how that happens and why understanding shock is one of the most important skills in anesthesia and intensive care. Shock is not defined by blood pressure alone. Shock is a state of acute circulatory failure where oxygen delivery is inadequate to meet the metabolic demands of the tissues, and this can occur even when the blood pressure appears normal on the monitor.
So the numbers can look fine, but the body is still in trouble.
Exactly, Noon, because shock is a disease of perfusion and cellular metabolism, not just a problem of low blood pressure. And if we wait for hypertension to appear, we have already missed the early and most treatable stage of shock. At the center of shock lies one simple principle: oxygen delivery, which is determined by cardiac output multiplied by arterial oxygen content. And when either the pump fails or the oxygen content falls, tissues are deprived of what they need to survive.
So if the heart is weak, or there is not enough oxygen in the blood, the cells start to struggle.
Exactly. And when oxygen delivery drops below cellular demand, cells switch to emergency metabolism, lactate rises, acidosis develops, and this is the biochemical signature of shock. Although shock always ends in cellular hypoxia, it does not always begin the same way, because there are different types of shock, each disturbing oxygen delivery through a different mechanism.
So the problem is the same, but the reason is different.
Exactly. In hypovolemic shock, the tank is empty. In cardiogenic shock, the pump fails. In obstructive shock, blood cannot move forward. And in distributive shock, blood flow is badly misdirected. But in every case, oxygen delivery falls below cellular demand, and shock progresses unless the underlying mechanism is corrected. Even when we restore blood pressure and cardiac output, shock may continue at the level that truly matters, the microcirculation, where oxygen must pass from blood to cells.
So the big blood vessels can be fixed, but the tiny ones are still not working.
Exactly. In shock, the microcirculation becomes disorganized. Capillaries stop flowing evenly. Blood is shunted past starving cells, and oxygen may be present, but cannot be effectively used, which explains why normal blood pressure does not guarantee adequate tissue perfusion. When oxygen delivery at the microcirculatory level fails, cells are forced to abandon efficient aerobic metabolism and switch to anaerobic pathways that produce far less energy.
Is that when lactate starts to rise?
Exactly. Lactate is not just a number. It is a signal of metabolic stress, reflecting inadequate oxygen utilization and failing cellular respiration.
So high lactate means the cells are running out of energy.
Yes. And if this state persists, intracellular acidosis develops, ion pumps fail, cell membranes break down, and organ dysfunction becomes inevitable unless shock is rapidly reversed. When cellular hypoxia and metabolic failure are not corrected, the damage does not remain confined to individual cells. It spreads to tissues and organs, leading to progressive organ dysfunction.
So one sick cell can make the whole organ sick.
Exactly, Noon. The brain becomes confused. The kidneys stop producing urine, the lungs fill with fluid, the gut loses its barrier function, and bacteria and toxins begin to leak into the circulation.
Is that why doctors worry about many organs failing at once?
Yes, because shock is not a single organ problem. It is a systemic disease. And once multiple organs begin to fail, mortality rises sharply unless rapid and effective intervention is achieved. When shock begins, the body does not surrender immediately. It activates powerful compensatory mechanisms designed to preserve life.
Is that why the heart beats faster and the skin becomes cold?
Exactly. The sympathetic nervous system increases heart rate and contractility, Blood is diverted away from the skin and gut to protect the brain and heart. And hormones such as adrenaline, vasopressin, and angiotensin attempt to maintain blood pressure.
So the body is trying to save itself?
Yes, but these responses are temporary. And if shock is not reversed, prolonged vasoconstriction worsens tissue hypoxia, myocardial oxygen demand rises, and the very mechanisms meant to protect the body begin to accelerate organ failure. In anesthesia and intensive care, shock becomes especially dangerous because many of the body's compensatory mechanisms are deliberately removed.
You mean because of the anesthetic drugs?
Anesthetic agents reduce sympathetic tone, positive pressure ventilation decreases venous return, and a patient who was compensating quietly can suddenly collapse at induction.
So shock can hide until it's too late.
Yes, which is why early recognition, careful physiological assessment, and treatment guided by the underlying mechanism, not just blood pressure numbers, are essential to prevent sudden deterioration and save lives. Shock is not a diagnosis. It is a physiological state where oxygen delivery fails to meet cellular demand, leading to metabolic collapse and organ dysfunction.
And it can happen even if the blood pressure looks normal.
Blood pressure alone does not define shock. Microcirculation and cellular metabolism matter more, and lactate is a marker of stress, not just hypoxia.
So doctors have to look at the whole picture.
Yes, early recognition, understanding the underlying mechanism, and treating shock before compensation fails are what truly save lives in anesthesia and intensive care.
Thank you for watching. We hope this session helped make the physiology of shock clearer and easier to understand. And if you found it useful, please leave a comment, hit the like button, and do not forget to subscribe for more anesthesia and intensive care content.